On my last video, someone posted the question. They said they were listening to a podcast, and the person being interviewed said that I'm paraphrasing a little bit, but they said that they had never had a patient with mold illness who did not also have Lyme disease. And so the question was, has my experience been the same, or what are my thoughts about that? So it's a good question. At the risk of being that guy who gets hung up on semantics, Lyme disease is a very specific thing, typically some form of a bullseye rash, joint pain, fatigue. It's a quick and easy diagnosis. Go on some doxycycline, and 90% of the time, everything's just all better. Whereas persistent borreliosis, also known as chronic Lyme disease, that's different entities. So I'm assuming that's what the person being interviewed was referring to. So in terms of whether I've seen all of my patients with mold illness also having chronic issues with Lyme, or the Lyme bacteria, Borrelia burgdorferi, I can't say that I've tested every single patient that I've had who has mold illness for the presence of chronic infections like Borrelia or borreliosis. So I can't say for sure. Many of my patients who have mold illness do wind up having a favorable response to working with systemic antimicrobials. And oftentimes that's been motivated by us running some testing to see what's going on, but not always. Sometimes it's more of a therapeutic trial. And in those cases, even when we test, I can definitely say that not everybody who we've tested for Borrelia, folks with mold illness that we've tested for Borrelia, test positive for Borrelia. Many of the times when we, out of the gate, the patient comes in, and this certainly isn't every patient that we work with, but when patients come in and they say, I've been sick for too long, I understand that the testing costs money, but I'm going to do the mold test, I'm going to do the Armin labs, comprehensive microbial panel, I'm going to do, test for heavy metals, do the whole 9 yards, or at least within the first few months of us working together, they wind up running all the tests, or a lot of the tests. The folks who test positive for mold toxicity don't all have borreliosis on their lab tests. And many of them do have some type of infection. Almost always we'll see a viral infection coming up. Oftentimes it's reactivated Epstein-Barr virus or Coxsackie virus, but not everybody has Borrelia, and not everybody even has a Lyme co-infection that comes up. Testing has its limits, so always question mark of, well, did the testing, was it a false negative potentially? But even the folks who test positive for a chronic infection, like they have mold, they also test positive for a chronic infection. Not all of those patients actually feel better when they go on the antimicrobial herbs to treat the chronic infection. Sometimes it's primarily the mold treatment that makes them feel better, and it does beg the question of, well, chicken or the egg, what was there first? And are the infections just there kind of running amok because the mold is, allowing that to happen? So there's lots of different permutations, and I definitely cannot say that every patient of mine with mold illness has borreliosis, but it certainly should be on the mind of the clinician assessing that patient, especially if that patient who's being treated for mold hits a plateau in terms of how they're doing with their treatment progress. One of the things I've seen many times by proxy is folks who come in saying, I was working with Dr. So-and-so, they are a specialist in Lyme or Bartonella or viruses or mold or heavy metals or whatever, and I worked with them and I improved, but I've hit a plateau and the treatment didn't help me further than that. It's because there's more than one thing going on in a lot of these patients with complex chronic illness. So really important to have it on the radar, but not always present in everybody, at least in my experience to date. So I hope that answered the question. If there's any further questions about this topic or anything else, please post in the comment section below, and I will leave it there for now.